Welcome in to Your Health, and we are so honored today to have with us Karen Hutto. Karen is with the Baptist Health System, but specifically with hospice. And there are some things, we're in really funny times right now. There are a lot of things about hospice that some people are still a little confused about, but we have some good news for you today, and we want to clarify some of those things. And we were talking earlier, before we ever start on that,
Right.
we are seeing a little decline in the COVID, thank the dear Lord.
Right.
But a lot because people are doing what we're doing, the physical distancing and wearing your mask. So please, folks, please do that, because you're the ones that are going to make the difference. And Karen, there is something very different about hospice with Baptist. I love what you do. And just tell us a little bit, number one, clarify what hospice actually is.
Hospice is providing care for those who have life-limiting illnesses that usually typically have 6 months or less to live. Not necessarily.
Right.
A lot of times when we get involved, if we get involved earlier, we can actually kind of help, and our tagline is to add more life to every day. So just because, a lot of times hospice people think about, oh, we're giving up. Well, you're not giving up. We're going to help you live what time you have left to the fullest that you can. And that's a very known misconception, is you don't have to be on death's doorstep to be eligible for hospice. I mean, we serve a broad spectrum of diseases: Alzheimer's, Parkinson, heart disease. So yes, life-limiting, but you can live a long time with those illnesses with our help and assistance for what we do.
So what all does hospice do?
Hospice, with hospice specifically, we provide care in the home. We can help manage medications. We can help manage care with physicians' offices. You can still, with hospice, you can still use your private physician, and we work with them. If you need home health aides to come in and help with bathing, personal care assistance, we can provide that as well. Durable medical equipment, if you need hospital beds, wheelchairs, walkers, that kind of stuff, we can help you with those as well.
So actually you just accommodate everything that someone who is not able to do the things that we're normally able to do.
Right.
And make that easier for them.
Right, and we're all about adding, with hospice, we're not, you've done moved out of the realm of caring. We're in comfort mode.
Okay.
So whatever makes you comfortable, whatever you need, we are going to help you be comfortable in whatever situation you may have going on. And not only for the patient themselves, but also for their family.
Very important.
Because you want to make memories, and we work with your family as well to make everybody
So
comfortable.
how would I get hospice?
Well, there's a couple of different ways you can talk to your physician, your routine physician that you see on a regular basis. They can contact us, and our number is 334-747-5000. We're also on the BaptistFirst.org website page. We have a lot of information out there as far as when's it time for hospice and how to reach us.
Okay. Now, will you do one thing that I don't think any other hospice actually does?
We have been around since 1984, and we take patients regardless of their ability to pay. There's a lot of gracious benefactors in our area that allow us to assist families when they need, and that's what we do. We're here to service the patients and the families in our community. So
it's my understanding that, that's a rarity that you also service COVID patients.
Right.
And
it is, because COVID kind of come out of nowhere and kind of hit our healthcare system really hard and really heavy. So we've had to adapt to, ourselves, how do we manage those patients? And so our team has done a great job at assisting our local hospitals and transitioning people home so that they can be with their families and not in an acute care facility.
I think that's one of the most beautiful things about hospice to me, is that what you provide as a service allows people to stay in their own home.
Right. And not necessarily their home.
Maybe where they want to be.
Where they want to be, whether it's an assisted living, it's a nursing facility, or in their home, whatever is their natural home to them.
Yeah, that's just a godsend. That is a godsend.
And we are very privileged to have some long-standing nurses who has been with our agency that are absolutely wonderful and caring and know specifically how to care for patients in their home, because it is a very delicate situation and delicate conversations and everything you have to have.
Well, I think that's a physical, mental, and emotional environment. Yes. All of those. It's not just physical.
Right.
And I would have to assume that the family, you're all going through this together.
It is. And another good thing about our agency is we are spiritually based as well, being part of the Baptist Health System.
Right.
We have a full-time chaplain on staff that is there to provide that spiritual support to that family, and that patient, regardless of what they're going through, to kind of help them make those connections and be okay with what's going on with spiritually as well.
That is the one thing that is essential. Mm-hmm. That is the piece of all that care that has to be there. Exactly. And Baptist provides that. Exactly. And we're just so great. And we're so blessed to have the Baptist system here in Montgomery, because we have
very fortunate.
Amazing, comprehensive care in surgery and heart and orthopedics and everything that you can think about. We have right here, and it's top-notch care. And that UAB specialty clinic, what a godsend.
It is. And like I said, a lot of people doesn't realize that Baptist Health has their own hospice, and we are.
Right.
We're there, and we're there to serve just like any other department within Baptist Health. We are always there and always going to do what we can to provide services.
Well, everything that Baptist does is going to come from a spiritual place, and that can be nothing but good.
It is.
So, oh gosh, Karen, thank you for coming in, and thank you for what you do. And folks, take advantage of this, and we will be right back.